Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professionals education. Now I'll point out to you in this series what's important, what's not so important. So let's go right to it.
Now we go on with the discussion of a structured oral examination. Remember, the criticism on oral examinations previously are based on mainly the construct under representation, the sampling, as well as the subjectivity in when the subjectivity is paired with the very low sampling, then it becomes very critical. Okay, so when we talk about structured oral examinations, we are saying that it's not all lost. It is not that we throw out the oral examinations, although in brackets long cases seems to be becoming less popular especially in the States and other places. But oral examinations as a whole should not be thrown out because it has its advantages. But how do we do it? How do we overcome the problems? Is by making them structured, where they candidates go through the same or equivalent same task. They do the same task under the same conditions for or the same duration of time in which they are scored objectively using the same criteria. Okay, how do we do that? There are many examples, and it's mentioned that once you plan an oral examination to follow this criteria, this you want it to have the same task, same conditions, same duration, same scoring, you become more and more similar to examinations like the OSCE and other examinations. Okay, and you might know that there is one form of assessment in which is oral based, but it is very similar to the OSCE, which is the MMI, the multiple mini interviews. Remember, interview is an oral exam, but if you make it multiple, shorter, with more examiners, with a very blueprinted areas in which to ask, it becomes more reliable, it becomes therefore more valid, and this is the MMI. Okay, and it is given the example there in page 131. And other examples of another example of a structured oral examination is the CSR. The CSR, which is the chart stimulated recall, is in which this is an oral examination, but it is very structured, and you look at the students or the candidates chart which he or she wrote about patients and based your discussion on that. There's a nice example given of a CSR scoring format in page 133, right? Okay, so it means that oral examinations have their strengths, but you need to address the threats to validity. Okay, and then we go on to scoring and standard setting. Scoring and standard setting in page 132. right? And we have not discussed standard setting in detail. It's going to be in a later class, but it's mentioned in this section that scoring issues for oral examinations are similar to those of performance tests. Right? It's not similar to essays or MCQs. It's similar to performance tests. The issues in scoring, the rating. Okay. It includes instrument design. Instrument meaning the form in which you use to assess the students for capturing and rating a performance, and procedures for combining marks, and things like that. Okay, so we will discuss this more when we discuss performance tests. And standard setting, although we wouldn't go into detail here, basically they suggest we use the borderline group method. The borderline group method or the Enghoff method. Okay, Enghoff method. Okay, we won't go into detail there because we have another section, another class just on standard setting. Okay. Now, what's very important in if you use oral examinations is training. And this is discussed in page 134. Okay, training is very important, and it mentions a bit about how we train the examinee. Basically, we brief them what they are going to face. Okay, it's mentioned briefly in page 134. A lot of discussion is given for selection, training, and evaluation of examiners. Rather than examinees. We must select, train and evaluate examiners for use in oral examinations, long cases, vivas, as well as in other assessments such as OSCEs and things like that. Okay, even for essays, as we have discussed previously. Selection, we need a criteria, and the author and they have discussed that in this section. And the training, it needs to cover familiarization with the format used. Familiarization of the format and what actually we are looking for in the candidates. And these are the domains that you are assessing in the candidates. And in this domain, the behavior that you would like to look for is this, this, and this, and this. Okay, this is what we call as the performance dimension. These are the performance dimension. These are the behaviors in which you look for to denote this domain, and when you familiarize them on this performance dimension, it is called as performance dimension training, or PDT. Okay, the other thing which you do is that for them to see candidates from the same viewpoint, from the same level, from the same window, and we do that in a step which is termed as frame of reference training. Frame of reference training, or otherwise known as FORT. Okay, what we usually do is we calibrate and have all the examiners look at and rate and encounter with a good candidate, a borderline candidate, and a poor candidate. So all of them have the same idea: what is good, what is borderline, what is poor. Okay, that is what we call as FORT training. The previous one is PDT. Okay, these terms are usually mentioned when we talk about observer or rater training. Okay, it's mentioned that this training will not be useful for certain, will not be effective for certain types of examiners. Okay, who are less consistent, and extremely severe, or lenient. So no matter how much you train them, they wouldn't change. That's the suggestion. And for these kind of people, it is suggested they be removed from the pool of examiners. I do not know whether that is possible or feasible, but that's the suggestion that's given. And other suggestions include mentoring by senior examiners and things like that. There's a nice summary of training and assessing of examiners in case example 8.3 regarding the American Board of Emergency Medicine Oral Certification Examination, table 8.3 in page 135. Please have a look at that table. Below that table is table 8. The case example 8.3, and then you have another table 8.3, which nicely sums up the steps in examiner training for a structured oral examination, which is actually similar for training for all kinds of rater dependent examination methods. Okay, finally, the author talks about quality assurance. Actually, which is focused on removing or minimizing the threats to validity. And there's a nice table 8.4, which summarizes the threats of validity and how we can remediate these threats. Okay, it talks about the what we do after the examination, and it talks about a bit about the cost as well, And lastly, this chapter is summary in page 137, where it recalls that oral examinations remain the subject of debate and dispute, especially examinations such as the long case, in which people are still debating and disputing, and you have camps for and against long cases and things like that. However, the authors suggest that oral examinations do have their uses, their strong points, but they repeat again the advice: if you want to use oral examinations, then please use multiple cases or stations with multiple examiners. Use a blueprint, which we will discuss later in our later classes. Means plan what you want to ask, what is covered in the exam. Use a structured scoring system. You need to select your examiners and train them. You need to monitor the preparation, production, training, implementation, evaluation, and feedback phases of the examination process. Wow, there's a lot. Okay, and use oral examinations as one component of a comprehensive assessment system. Remember, you always have combine with others. And that is all regarding oral examinations. Thank you.